good a month later. They out of pocket with these sound effects. Y'all, this week we're doing something a little bit different and we're reacting to an extreme extraction video. Wait, do I look naked? Let me reframe. So this video currently has 4.1 million views. And it caught my eye because I saw that dark skin tone and I was like, oh word, let's watch. But let's watch together.
My name is Falayemi and I'm getting an extreme blackhead removal procedure, but before we get into that, subscribe down below. My skin is very oily. I shine like a disco ball sometimes. I've never had acne throughout high school. It's really been within the last 2 years that I've started to notice that I've had acne. I want to get my blackheads removed because I know that's the first step in being able to clear up my skin and making my complexion even.
Okay, first of all, she's so damn pretty, right? Second, I feel like her experience is something that a lot of us can relate to. We may not have gotten acne when we were teenagers, but now we're dealing with it in adulthood. I know, because that mess happened to me. So while acne in our teen years is primarily caused by an overproduction of sebum, when we become adults, our skin's not producing as much of that sebum. And likely the cause of our acne is hormonal changes. And the thing is, you can't treat adult acne like you would when you were a teenager because, like I said, as we get older, our skin tends to not be as oily as it was when we were younger. And a lot of products that are used for teenage acne can be mad drying on adult skin.
When we have those deep blackheads,
oh shoot, it's Dr. Michelle! All right.
Sometimes if they're quite deep, you really have to manually extract them to get good results. Hi, my name is Dr. Michelle Henry. I'm a board-certified dermatologist practicing in Manhattan, New York. So this is a really comfortable procedure. I think a big part of pain is actually anxiety. We get so worked up about what's coming. And what I do is I really talk my patient through the procedure because I think if you can expect what's coming next, it really reduces your perception of the pain.
Okay, so they introduce themselves. Dr. Michelle explains what she's gonna do. She kind of alleviates any anxiety that she may have. Fuller then says that she's excited to have this procedure done and she's excited to see Dr. Michelle because she's a black woman as well. Now, some folks got a little salty about that in the comments. About some, why are you mentioning race? Like they ain't videos of people of color getting jacked up by skincare professionals who don't know our skin. Or maybe I'm excited to see somebody that looks like me taking care of me in this capacity. Something that they don't have to think about because they are considered the default. Anyway, carrying on.
So Fulla's skin is a little bit oily, which is what we expect. So I think she's going to be very happy with the procedure. She's going to tolerate it well, and I'm excited about doing this for her. The first step is to cleanse the skin. So we know that bacteria plays a role in acne, and what we don't want to do is reintroduce more acne into the clogged pore. I used an 18-gauge needle. I'll introduce it into the pore.
Yo!
So I use two approaches. I'll use two cotton-tipped applicators to evenly apply pressure and encourage that clog to be removed.
They out of pocket with these sound effects.
Or I will use what we call a Komedo extractor. So the Komedo extractor also allows for even pressure around the pore to allow that clog to come out easily and gently. Another reason that I nick the pore first is because I want to reduce the amount of pressure that is required to get this out, to reduce any trauma to the area so that we don't damage the pore and cause enlarged pores or scarring or hyperpigmentation. And that's why I always encourage my patients not to do this at home because it is very difficult to make sure that you have even pressure. And if you don't have even pressure, what can happen is that that clog can actually go backwards and that can cause more inflammation.
Yo, they are killing me with these sound effects. I know some of you are watching this at home being like, man, I can do that. I ain't gotta go to the dermatologist. But she just said, don't do this at home because you may not apply the right amount of pressure. Oh Lord, I hope y'all ain't got them needles at home poking and prodding in your skin because you can cause a really bad infection and make things worse for you. Plus, there are some things that can be on your skin that you may think is acne, but it's not acne, and then you just make matters worse for yourself. I know the internet will have you thinking that a lot of this stuff can be DIY'd, but don't do it to yourself. No, imagine going to the ER because you done stabbed yourself in the face. Nah, that was like a volcano. I had something like that, like a pimple on my face like that years ago. And, you know, my dumb behind popped it. And everything that was inside just shot out on the mirror. And, you know, the aftermath was I left like, a hole in my face, which, you know.
Are you dumb?
Made matters a little worse. So don't be doing this kind of stuff at home, y'all. Like, seriously.
Actually puncturing the pore, I use a tiny needle and you barely feel it because it's so superficial.
As somebody who gets injections and has gotten them with Dr. Michelle, it looks a lot more severe watching it than it does actually getting it. Because I ain't gonna lie, that looked like she put a sword in her face. But again, for personal experience, getting injections, it looks a lot more aggressive than it actually feels. It feels like a little pinch. And she's not even numbed here. So this is not even something where they need to numb the skin. Now, I ain't gonna lie. When I got RF microneedling, no. The first time it was fine. That second time, no, I was screaming bloody murder in that chair.
Oh, Jesus Christ. Ah! It's okay. Oh, God. Oh, God.
I can do one more right here where you really want the texture. Two.
Okay, wait.
And then we're going to the more shallow needle.
Okay.
One.
No! And then, you know, afterwards it was fine. You know, you can watch the microneedling video, you know, over here, right after you finish watching this one.
It doesn't take a long time, so we don't have to numb the skin because it's very comfortable. So you walk into the office, within 5 or 10 minutes you're all done and you're home to enjoy your new blackhead-free skin. So you're going to be a little puffy. We have some areas that are a little bit red. That's going to subside slowly, even in the next few minutes, definitely by tomorrow. I can tell already that you're a little bit smoother. We're not seeing as many of those open pores. Even with a little bit of puffiness, I can see that you're going to look really good.
Honestly, Dr. Michelle is the sweetest person. Like, what you see here in this video is what you get in the office. There have been times where I have gone in Dr. Michelle's office and I know she has got to be tired, run ragged, but she is always the most attentive and sweetest person. And those are the kind of things that you look for when you're looking for someone to take care of your skin. Not only your skin, but like in the medical field in general. Might be a little bit difficult to find sometimes, but doing things like reading Google reviews, getting referrals from friends and family, going in for consultations and seeing how you feel about this person, it's almost kind of like dating. Like, if you kind of feel little red flags when you're out on a date, you're like, let me not. It's kind of a similar thing when you're looking for someone to work on your skin. Definitely want to use that intuition there and, you know, pull up the receipts as well. Obviously, this is not a one and done kind of thing. You're not going to go in, have somebody squeeze your pimples in and you're good and you kill it, right? There is going to be multiple types of treatment depending on the type of acne you have and how severe it is. You may be looking at things like some prescription topical treatment. You might even be given some oral medications to help balance your hormones if that's the cause of your acne. Cortisone shot. They may recommend lasers. They may also do peels. And then there may also be some post-acne treatments, such as treatments for the scars, like the kind of pitted scars that you may get from acne, and of course the post-inflammatory hyperpigmentation. There may be also a really holistic look into what you do with your lifestyle. Perhaps something in your diet may be making your acne worse, maybe some other medication that you're taking. So you definitely want to take a holistic approach when it comes to acne. And don't be afraid to ask questions. Jot them down before you visit. That way you have them all so you don't forget anything or you don't get nervous and forget to ask. And if you have a provider that doesn't want to answer your questions or seems annoyed by it, red flag. If you have moderate to severe acne, I highly recommend seeing a Skin of Color pro to deal with your acne. Doesn't always have to be a dermatologist. You have some really skilled estheticians out there, but whoever you go to, you definitely need to look up the receipts to make sure that that's the right person that should be treating your skin. And speaking of skin, let's see what Fola's results are.
Procedure's over and I'm really happy about it because my face is numb, but that's okay because I know I'm going to see the results in a few days. I'm really appreciative of Dr. Henry for what she did.
Now this after is directly after the procedure, so there's not going to be that much of a dramatic result.
And I'm just hoping that, you know, my skin will get better after this.
So the good thing about the blackhead removal is that there are minimal side effects, if any, and really very little potential for any long-term consequences. So really lots of upside and very little downside.
He's looking good a month later, and I like that these results that they're showing are realistic. Because you go on the internet, you have somebody thinking that you can go from severe acne to glass skin in a weekend, and that's just not realistic. Especially with our skin, we have the post-inflammatory hyperpigmentation, and that can take some time to clear. Acne itself can sometimes take 6 to 9 months to clear, and then sometimes you may have additional breakouts, which is why I always recommend the skin diary, because you can kind of like, okay, what did I eat that day that maybe triggered my acne, or how was I feeling that maybe my stress and my mood affected my acne, or what product did I use? It's a very good idea to keep things documented. It's also a very good idea to not do certain things when it comes to battling your acne at home. And to make sure that you're not making those mistakes, go ahead and check out this video. I'll see you there.